Welcome back. We are talking about lab tests, investigations, talking about getting to the bottom cause of whatever health issues or symptoms you might be experiencing. It is just a matter of time for us to come across some sort of nutritional deficiency. And when that happens, we need to know how to tackle. So today is all about nutritional deficiencies, reminding you that nutritional deficiencies can be something serious. So this presentation is for educational purposes only. If you need to act, you need to contact your doctor or a qualified health professional. Okay, do not self-prescribe supplements. Don't change your medication without professional guidance. My role here is to help you to understand your body better, to ask better questions, and explore safe, effective options alongside your healthcare team. All right, so let's start talking about nutrients in perimenopause and how is that the demands of our body changes so much when we're going through perimenopause. So perimenopause, as we spoke before, is a time of hormonal shifts. There's a lot happening inside of our bodies. Now imagine if there is a workplace, an environment that requires a cleaning crew every week to come in and make sure everything is clean and in the right place. And coming to this workplace once a week is just enough. You have a small crew, 3, 4, 5 people, whatever, but it has been consistent. But all of a sudden you start having events, you start having daily functions, or you start having construction in your workplace, and the changes need. The environment is the same, but because of the changes that are happening inside that environment, you need more people joining the cleaning crew, or you need that cleaning crew coming more often. Same thing is happening inside of us. Things are changing. We have different demands and we need to attend those different demands. That's when you start realizing that you've been doing the same thing for so many years and has been working fine, but all of a sudden it's not working anymore. It's because those demands are changing and we need to be able to understand those demands and respond to it. Okay, now there's something else that happens as well, and that happens as part of aging. It's gonna happen to every one of us, men included. Absorption and synthesis of vitamins and minerals decrease. We're going to cover this today. Deficiencies in this time of our lives can worsen those symptoms that may appear as part of perimenopause. So one thing that I'm always going to bring for our discussions, perimenopause and menopause doesn't need to be a place of suffering. It all depends on how we navigate those waters. It all depends on how we support our bodies. So if there's going to be fatigue, mood issues, sleep issues, cravings, bone loss, do you agree that if there are deficiencies in places, and if we're not doing the right thing to support our bodies through this transition, those symptoms are going to be present for sure, and they're going to be worse for sure? That's when we come in with all this work that we're going to do together to make sure that you navigate those waters without suffering. And if those symptoms may come to show up to you, they might be just very mild, or they might not be very consistent. You might experience them every now and then because you're doing the right thing for your body. But the goal here is to navigate perimenopause healthy and feeling good about yourself. So putting those symptoms at bay. Most deficiencies are missed in standard checkup. So we spoke about a few of them so far. We spoke about our lab tests that are going to test for iron, for B12, for vitamin D. Those are quite easy to pick up, but a few of them usually go under the radar, and that's what we're going to explore today. Now, there's other factors that increase that situation inside our bodies. So there might be women experiencing more erratic bleeding or heavier bleeding. Erratic bleeding is that bleeding that's a little bit out of whack. So some women, for example, might have their period twice in a month. Some women might bleed for a whole month. Some women might bleed a lot in just a few days. And this can impact on our iron levels, on our ferritin levels, leading to iron deficiency and anemia. So this is something that is very common, sadly, in women having that iron deficiency. It's important to stay on top of it. And this is an easy one. You can go and test that every 6 months if you have to, okay? Now, there's those changes in our body as well that I said that happens a long time with aging. So it's lower stomach acid. It's changes in our gut microbiome. But in perimenopause specifically, we also see some hormonal changes. And these together impacts absorption of vitamin B12, of iron, zinc, and other minerals. There's some skin changes that happen as well, along with the hormonal and kidney changes that result in less vitamin D conversion. So once again, you might be getting the same sun exposure as you did in the past, but all of a sudden you're showing with vitamin D deficiency. Increased levels of cortisol and stress depletes magnesium, zinc, and B vitamins. We also have some medications, we touched on a few of them, that can lead to nutrient depletion. So it's your antacids, it's your cholesterol medication, it's your blood sugar medication, the OCP as well, which may be offered. The OCP is the pill, the oral contraceptive pill that may be offered to a lot of women going through perimenopause to keep the symptoms under control or to correct that heavy bleeding. Okay, so those medications can lead to nutrient depletion as well. Dietary changes that might happen because our lifestyle is changing. So we're juggling too many plates, we're looking after our kids that demanding a lot of our attention, you might be looking after our elderly parents, we might be going for career promotions, we might be so busy that sometimes even without noticing, we start snacking more on processed foods, we start skipping breakfast because we're too busy in the morning, we start ordering more takeaways because we don't have time to cook, and that could lead to a lower nutrient intake as well. Alcohol consumption can also deplete some key nutrients, and it can impact the absorption of some others. And sadly, we see very often women that are in this situation that I'm telling you, it's too busy and there's too much going on, and finding that comfort in a glass of wine at night before bed, it's something that a lot of women are reaching for. And this alcohol consumption, especially if it's consistent or if it's in high amounts, can also impact how your body keep and absorb nutrients. Okay, and there is the high caffeine intake that's sometimes coming to the same picture, the picture of the woman that is too busy and there's too much going on and you're tired and you rely on caffeine. Caffeine interferes with absorption and increases losses because it has a direct effect. Every time we go into the bathroom, we are losing some stuff, and some good stuff can come out as well, and some bad stuff can come out. So it's a good thing overall, but just so you are aware, if you are consuming a lot of diuretic drinks or foods, you may be also losing a lot of electrolytes, for example. And with caffeine specifically, it interferes with absorption of iron. So the tannins that we find in caffeine, in coffee, in black tea, in wine, can interfere with iron absorption. So if you are taking your supplementation with a cup of coffee in the morning, they are fighting for absorption, and caffeine may win that battle, okay? And speaking of, there's this thing called bioavailability. It's not just about what we put in our mouths, what we put in our body, it's what it's available for our body to use. So you might be eating something that goes straight out. It doesn't get absorbed, so it doesn't affect the body, neither in a positive or negative way. When we are talking about nutrients, we want to make sure that your body can actually use whatever you are putting in your body. If it's through drinks or food or supplements, it's important that it's bioavailable. And speaking of bioavailability, it's very important for us to know that water is one of the main ways of transportation in our body. And there's those water-soluble vitamins like vitamin C, for example, or the Bs, they travel in our body with water. If our body is dehydrated, if we're not drinking water, guess what? Our body is not going to be able to make the best out of those vitamins. And there's another group of vitamins that we call them the fat-soluble vitamins. They travel in our body through fats. So vitamin D, for example, vitamin E needs fat If we are not eating fats because we are in a low-fat diet, guess what? Our body is going to have trouble using those vitamins as well. There's this thing called cofactors. It's like little buddies that are needed in order to get a job done. So it's like if you needed to finish a project at work and you have a co-worker, that co-worker is your cofactor. He's going to help you to finish that job. If he's not there, you're not going to be able to finish. So a classic example, it's vitamin D, magnesium, and K2, which are cofactors for calcium to get to the bones. If they are not present, calcium doesn't get into the bones as we want to. Vitamin C, for example, enhances iron absorption. So if we take a drink containing vitamin C, or if we eat a food containing vitamin C, or if our supplement has iron and vitamin C, that iron is going to be absorbed better. And in the same way, there are some guys that fight for absorption. It's a competition that happens, like calcium and iron, for example, because they use the same receptors. Receptors are like little hand-like projections like here, waiting for something to come in so they can grab it and bring it to your system. So it's waiting for calcium, but it's also waiting for iron. If you take them both together, someone is going to miss out on the absorption and it's going to be excreted without being absorbed. Important, right? It's good for us to know that it's not just a matter of putting in our mouths, it's a matter of understanding if our body has what it takes to use that vitamin or that mineral. Now let's talk about the big five. It's the big five deficiencies that I often see. So iron is one of them. We've already spoke about it. Now iron is so important for energy production. You can only imagine what happens to your body when it doesn't have that way to transport oxygen. Vitamin D, it's a big one as well, and vitamin D supports your bones, your mood, your immune system. B12, which is very needed for energy, nerves, and brain function. Magnesium, that helps with your nervous system, with your sleep, muscles, and blood sugar balance. And zinc, which is key for hormonal balance, skin, immune health, digestion, and wound healing. Now, can you imagine how much your body is going to suffer if you are deficient in some of them, if not all of them, which I've seen in clinic before? And beyond those five main ones, there's folate, there's calcium, there's selenium and iodine, there's CoQ10, which is a very, very important factor for energy, declines naturally with age, but also with medication, and the electrolytes that we need so much for muscle function, for energy, for nerve signaling, for heart rhythm. So if you're experiencing heart palpitations, it's something that you should be looking at. And there's something that we don't speak about very often, because when we talk about deficiencies, straight away we're thinking about vitamins and minerals, but we might be missing out on the big picture. And in perimenopause, it is often those everyday basics that are missing. Yes, we have to investigate for those micronutrients. Micronutrients are those guys that we've seen so far. They are micro because they only needed in small amounts. We don't need a lot of iron. We don't need a lot of zinc. We just need a little bit. But there's this group that is called macronutrients, which I'm sure you're familiar with. Some people don't know what they call macronutrients though. Macronutrients are needed in large amounts. We need them every day and we need them very often. The first one that I see a deficiency in, it's fiber. Sadly, we are not eating enough fiber. We as women, but we as a society, we as a whole, because the whole world, we've seen recent studies coming up showing that most developed countries are not consuming enough fiber. And fiber is so important for gut health. Now remember, we're going to go deeper into this. Gut health is the basis of everything that happens in our body. It affects our immune system, it affects our mood, it affects our cognitive function. If the gut health is not okay, our whole body is going to suffer. Now fiber is the main food for the gut bacteria. If you're not feeding those guys, they're not going to be happy. And if they're not going to be happy, you're not going to be happy. Fiber also, it's great for hormone clearance. So for people, especially for women who are experiencing those peaks, those high peaks of estrogen, it's very important that your body is able to clear the excess hormone that you don't need. So you metabolize, you get rid of it. Because if you don't get rid of it, if you're constipated, for example, and stays in your system, it gets reabsorbed in your bloodstream and goes back circulating in your body. So you are already experiencing peaks of estrogen in your body because of perimenopause. But then if you're constipated, you are going to be experiencing symptoms on steroids. It's going to be much worse. Fiber also helps with blood sugar balance, with sugar cravings, with satiety. It's such a beautiful macronutrient. And we're going to have a session dedicated just to cover everything you need to know about fiber and how to increase that on your day-to-day diet. The second one is protein. Now, there's a little bit of a issue going on at the moment. There's some people that might be even consuming too much protein because there's so much hype around protein at the moment that some people are really going nuts at buying fortified foods and, you know, drinking the protein shakes and the protein water and the collagen. And if you put this all together, it's a lot of protein and it's not needed. We don't need protein in such amount that can be actually harmful for your body. But on the other spectrum, on the other end of the spectrum, people who are not jumping on this hype and getting this supplementation and those fortified foods going, they might be experiencing low protein intake. And this is very common as well. I see that very often in practice because protein has to be eaten throughout the day in certain amounts. And a lot of women are just, you know, getting out of the house in the morning and grabbing a croissant or a banana bread or maybe just some toast with Vegemite, and that's their breakfast, and there's no much protein at all in their breakfast. And then lunchtime comes and they're too busy and they drink a coffee with a sandwich, and in that sandwich there's going to be a tiny little portion of protein. And by the time they get home at night to eat their proper meal, a whole day has gone when they pretty much didn't consume any protein. Once again, there's a lesson just about protein for us to cover all you need to know. Same thing with healthy fats, which is so important for hormonal production, brain health. And remember, when we're talking perimenopause, we're talking about hormones, we're talking about brain cognitive function, we're talking about being too hungry. So healthy fats, it's so essential as well. And because fats have been demonized, especially in the 80s and the 90s, depending on your age, you lived through that period in which we were told not to eat fats. And a lot of women are still avoiding fats and suffering the consequences of not eating their healthy fats. Water is very important as well, needless to say. It's important for energy, digestion, brain health, temperature regulation. So if you're struggling with hot flushes, this is very important. And the last one here is another one that has been demonized and therefore not eaten properly for a lot of women out there. Good quality complex carbs, which is needed for your energy, for your cortisol balance, for your gut microbiome. So when we look at those macronutrients that should be abundant in your life, if you are missing out in any of them, your body is going to be struggling in some way. And each one of them has a special lesson on. So by the end of the program, you're going to be on top of all of them. This is just a lesson on deficiencies and how they can show up in your body. And this is going to be in the form of fatigue, brain fog, low mood, anxiety, irritability, poor sleep, muscle cramps, restless legs, brittle nails, hair loss, dry skin, recurrent infections, slow wound healing, bone loss or fractures. Now look at a whole lot of things that we can avoid if we get on top of those deficiencies, even before they show up. We don't want to see any deficiencies showing up at all. We want to be on top of it so it doesn't turn into deficiency. It can also show up as pain and aches, poor immune function, sugar cravings, excess hunger, weight gain. And aren't these the exact things that we're trying to fight off during perimenopause? And if you do not correct those deficiencies on its source, remember we spoke about it, we've seen that before. It's like a band-aid. You're going to be stuck in a cycle when you're consistently trying to fix the health issues or the symptoms, and they're going to keep up showing up. Until that deficiency is addressed, the band-aid cycle will continue. And I want you out of that cycle. How to identify if you are struggling with deficiencies. The first thing is to run those lab tests. We've already spoke about it. But the other thing as well is to listen to your body, because remember, lab tests don't cover everything. And even if they do, sometimes we might be within range. Remember, we spoke about that, but that optimal range is not exactly enough to make us feel good. So we have to listen to our bodies. If you're struggling with persistent fatigue, with cravings or constant hunger, with mood changes, brittle nails, hair loss, muscle cramps, restless legs, weight gain that is not explained, that you don't understand why, you're still eating the same thing, you're still moving the same, and you are moving and you're eating well, but there is weight gain, recurrent sickness, hormonal health, poor sleep, all of these can be signs of deficiencies. Your body is trying to tell you something, and we need to find out what they are. And also look at your lifestyle, be proactive, because if you are experiencing heavy and irregular bleeding, chances are you will be at some point be experiencing some sort of iron loss and iron deficiency or ferritin, low ferritin levels. If because of your lifestyle, your work arrangements, you get low sun exposure, this is another thing that you can be proactive about it, because chances are you will experience some sort of vitamin D deficiency at some point. So go and get tested. If your diet is low in protein, in fiber, or in variety, if your diet is not, filled with the rainbow colors, well, you can start being proactive about it. Wait, hold on, I'm not eating enough protein, I'm not eating enough fiber. With fiber, for example, I'm not going to wait until I'm terribly constipated to act on it. I'm going to start acting on it straight away. If your lifestyle includes moderate to high alcohol intake and caffeine or caffeine, you might be prone to deficiencies as well. If you're not drinking enough water, if you're taking medications, if your life is highly stressful, get onto it. Don't wait until those deficiencies show up. Reminding you that the best thing to do is always to treat your body as a whole system, and also to understand why. Why is that? Why do I continue getting certain deficiencies? And then you can go and work on the root cause so it doesn't continue happening. We need to develop a targeted strategy, meaning it needs to be for you, it needs to be specific. It's not as easy as going to the supermarket and buying a multivitamin. It has to be targeted. And then you need to test, target, and retest to see how we are improving. And alongside with tracking signals, we're not just looking for numbers, we are observing how our body reacts. And of course, by following the program, you're going to be addressing all those little issues, because now in this initial module, we are just covering the whole picture, and then we're going to start digging deeper in each one of those topics, including supplementation, which is coming next. Okay, take one step at a time, follow the program week by week as it is presented to you. The modules are done in a way that they build on each other. So follow the system, trust the process, and don't forget to act, because having a lot of information doesn't help. Information overload actually put us in a state of inaction, because there's so much we don't know what to do. So as you learn, start acting on it. In every single week, I'm going to give you an actionable task, and I want you to act on it. Okay, so coming next, we're talking about supplements. You know where to find me if you have any questions about what we discussed today. I'll see you soon. Bye.